I had started to flirt with diabetes, and just prior to having surgery, it was becoming a real concern for my regular doctor. I was not on medications yet, but we were getting real close to, my doctor was saying that, that was going to be the next thing if I didn't really do something about my weight and diet and that kind of thing to try and control it. I've also had high blood pressure and cholesterol issues for years, maybe 15 years. I also had a lot of joint pain, back pain. I snored like a chainsaw. I didn't sleep very well. I had knee pain. I found myself making excuses not to get out to go fishing or to get out and go bird hunting or to even go out and work in the shop or do anything. I'd find myself really tired after work, just come home, crash out on the couch, maybe watch TV, have dinner, and then go to bed. And, I just wasn't active, didn't have the motivation to get out and be active. I had dieted on my own, off and on for several years. And actually my relationship with Dr. Sasse and his office started years ago with my wife. And so I had a relationship here, and I knew that Dr. Sasse did a lot of bariatric and weight loss work, and actually was here in the office with my wife on one of her appointments, and saw the pamphlets and some of the charts and things on the wall in the office, and it just clicked at that time. I thought, hey, now that might be something for me. The support groups, the diet, the nutrition portion of it, I think all of it goes together to make this successful. And if you leave any part of it out, then you run the risk of being unsuccessful. Life is still normal afterwards. It's just different than what you were used to. Life has been great afterwards. For me, this has been truly pressing the reset button. I'm definitely more active now. I don't take 3 prescription medications that I used to have to take. I had my last doctor's visit recently with my regular doctor, and he was just amazed about how my blood work and those kind of things were in the normal range, and that everything was good. He was amazed at how much weight I'd lost. He was not supportive before I had the surgery. He was in the Marines or in the military or something earlier in his life, and he was a strong advocate of portion control and diet and rigorous exercise and that kind of stuff. And I think that he has a much better feeling about this kind of weight loss surgery now that he's seen somebody go through it and the success that I've had with it. For me personally, in my personal life, I have a lot more energy than I had in years. I've been out fishing, I've been out hunting, I've been out doing all the things that I like to do. I make excuses to get out of the house, to go out to the shop, to go work on stuff, to work out in the yard. It's just been a great change. My physically, I don't hurt the way that I used to. I feel like it's taken 10 years off of my life. I really do. Some people that are close to me that knew were apprehensive about it. With a major surgery and the extent of the kind of work that's done in there. But now with the results of it, seeing the other side, they see how worthwhile it was. Especially my wife, she's just been wonderful all through it, and she'd run to the store and grab stuff for me. If you want to try this, you want to try that. Especially those first weeks after surgery when, trying to find something that tasted good but still fit within the guidelines. And this support that Dr. Sasse and Dr. Sasse's office staff has given has been really a big help. Obviously, there's a lot of personal knowledge here, personal experience here that when I've come in for appointments, I've been, always felt like sort of part of the family, if you will. And that's been really a nice feeling that it's a personal, to me, again, it's a very personal experience, and I feel like they've treated me that way at a personal level, and I really, really appreciate that. Having the gastric sleeve surgery has done for me that was a problem for me dieting was I was always hungry. I was always just starving, and I'd have a little portion of something and, portion control. And I'd no sooner put down my fork than I was thinking about what I was going to be able to eat next and that kind of thing. And so with the gastric sleeve surgery, I no longer feel hungry. It's very seldom when I have hunger pangs. I still drink the shakes every day. That's pretty much what I have for breakfast in the morning. I get up in the morning and I make a big giant shake. And I take that to work with me, and that keeps me going usually all throughout the day. I have been amazed at how many people have noticed how much weight I've lost and say something to me about it. And there's definitely not a week that goes by, and a lot of times there's almost not a day that goes by that I don't run into somebody and they lean across and they say, "Are you okay?" or that kind of thing, or have you lost weight? And yeah, I've lost about 75 pounds. And wow, you look great, and that kind of thing. And so, everybody likes a little ego boost, and I think that goes a long ways towards continuing on with the success. I've noticed lately that things are too sweet, and that's probably been the biggest change in me, is that I'll have something like, say, some ice cream, and I'll go, wow, this is really sweet, and not eat it because it's just too much. I knew I needed to do something, and after trying diets and rebounding back and above even my previous weight, I knew that wasn't it. From being hungry all the time and just really suffering through the diet programs, I knew that wasn't the answer. And again, when listening to Dr. Sasse and talk about some of the hormonal changes and some of those things, how they can affect your weight loss and kind of do a reset of your internal system, really made sense to me. He was very knowledgeable. He's very professional. I think that his program for weight loss and for surgery and the whole way of doing things, starting with an orientation and the support groups and nutrition and the whole package, I think is very well thought out. I think that Dr. Sasse is truly engaged with his patients. I think that he truly believes in bariatric and weight loss surgery for people as being a way to successfully lose weight and promote healthier life and healthier lifestyles. And I'm very pleased to be part of this program, and I've never felt like it was a just trying to push patients through for the money, that it's always been about the patient and about what's in the best interest of the patient. Way better than normal. I am back to way more than better than normal activity. Absolutely.
You surpassed that.
Oh yeah. Yes, I have. Like I said before, my life has changed in so many ways. I feel like I'm 10 years younger. I feel like I did when I was in my, 40 or even in my 30s. I feel great. I can't stress that enough. I feel fantastic. This has been one of the best things I've done for myself in my whole life, other than marrying my wife.